To measure active range of motion for ankle inversion, the patient is seated. The knee has to be at least slightly flexed in order to allow this movement in full active range of motion. The goniometer is simply placed more or less on the lateral surface of the lower leg. The axis of the goniometer is simply oriented anterior-posterior and kind of off the leg a little bit like that. And the moving arm is simply pressed up against the bottom of the calcaneus, nice and flush. So that's your starting position. Then can you bring your foot across? That's excellent. And then ending position, same thing. Moving arm or stationary arm is simply lined up against the lateral surface of the leg. The axis is still anterior-posterior, and now the stationary arm or moving arm is again pressed firmly against the calcaneus. So we get a measurement in that case of about 20 degrees of ankle inversion. Again, this was started at, that's your starting point. That's 0, even though there's not a 0 on the goniometer. So then you just have to count and do a little math to figure out that you have about 20 degrees of ankle inversion. Notice that we are measuring this in the rear foot. So this is measuring ankle inversion at the subtalar joint. It does not include any inversion that may occur at the transverse talar joints.